Hello, Dr. James Bogash, expert in health and longevity, and is a practicing chiropractor who treats my fair share of knee, all conditions from acute injuries to osteoarthritis, people that are ready for knee replacements. This particular article really rings true because it talks about a tool that a lot of people don't use and yet can be very powerful for helping with or recovering from knee dysfunction, knee pain, knee instability, osteoarthritis. And this is whole body vibration. Whole body vibration is a platform that you stand on and it vibrates at a certain or mixed frequencies. We've had a pretty high-end sonic unit in our office for, I'd have to say 15 years. And for people with knee pain, it's almost always a part of the protocol. And I'll talk a little bit more about what else we do with that. But the whole idea is that we need to move. For people with knee arthritis, the worst thing you can do is nothing. We've seen time and time again that the people that walk more, do more knee strengthening, are less likely to need a knee replacement. And yet, all too often, we go the opposite direction. We shut down, we stop using the knee because we're afraid we're going to make it worse. And the opposite is true. The more we use it, the more it's going to be happy with you. So when somebody this was a study looking at whole body vibration, looked at both doing it on a stable surface and an unstable surface, which is not something that we do in our office, but it's kind of cool. So this idea of maybe doing it on like a wobble board or a little bit of an unstable surface on top of the whole body vibration, not a whole lot of research on it yet, and we don't use this in an office, but it certainly makes me wonder if it might add that much more stability and benefit to especially our athletes who are having problems with knee instability or being able to cut. So what they found in looking at across multiple studies is that whole body vibration helped increase strength, balance, muscle activity as measured by SEMG, electric myography, and proprioception, so the awareness of where the joint is. All those things were improved by whole body vibration. Now, as I mentioned, in our office, that is not a single tool. Anybody who comes in is going to get soft tissue work, most likely Graston, like an instrument-assisted type approach around the knee to work on the fascia to make sure everything's moving okay. We're going to make sure that they're moving and that we reinforce the idea that they need to be moving. Obviously, managing weight's an important part. The challenge is sometimes we need to be moving to lose weight, but that is a long-term approach, obviously not going to be a short-term approach. Strength training, so even something just as small as squats. We'll even have our patients do small squats on whole body vibration. The idea is that you're strengthening it and building proprioception and balance around the knee. There are other tools like PRP, platelet-rich plasma, or even stem cells that can help with the knee. When we put all of that together, most people are going to not need knee surgery. I'd be lying if I said we fixed everybody. There are certainly some conditions and some knees that are too far gone for us to help. But geez, oh Pete, before you get a knee replaced, you always need to look at other approaches, and you need to make sure that you're moving. And if possible, putting whole body vibration as part of your treatment plan for your knee arthritis. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.